I just want to explain why we can consider today myelofibrosis a progressive disease. And it's quite important because if you use only watch and wait or observation, you can only watch the progression of the disease. And myelofibrosis is progressive, as we demonstrated that the time spent in these different risk categories is 4.9 years for low risk, 2.1 for intermediate 1, 1.7 for intermediate 2, and 0.7 for high-risk patients. So this is a clear demonstration of the progressive nature of the disease. And again, we have also information that the spleen and symptomatology is progressive. And I just quote the COMFORT-1 trial. Remember that the COMFORT-1 and COMFORT-2 as well was developed in patient intermediate 2 and high risk, non in intermediate 1. But you can see here in the blue curve that is the trend of increase of the spleen in patients who receive only a placebo. So in 42 weeks, there is an increase of spleen size. And if you check here, the different symptoms we encounter in patients with myelofibrosis and check the gray line, that is the placebo line, you can see that there is a constant increase of symptomatology for each symptom. So abdominal discomfort, pain under left ribs, early satiety, night sweat, and itching, and so on. So this clearly demonstrated that myelofibrosis have progressive symptomatology and progressive splenomegaly. And again, bone marrow fibrosis is important, is the biological typical aspect of bone marrow picture in patients with myelofibrosis. And we can grade bone marrow fibrosis from 0 to 3. And we know that with the increase of bone marrow fibrosis, you have a decrease of the level of hemoglobin, decrease of platelet count, increase of blood cell, increase of leukocyte, increase of splenomegaly, and decrease of survival. So all these conditions, spleen, symptomatology, bone marrow fibrosis, are progressive in patients with myelofibrosis.